Good morning, Mr. McGarry, Paul McGarry. Welcome to Adinberri Congress.
Good morning to everyone. I wish I was with you actually in San Sebastian, in the beautiful part of the world, instead of being here in Manchester.
Well, hopefully next time, because I think this collaboration is just starting. So you are the CEO of the Greater Manchester Aging Hub. We are really looking forward to knowing about your hub and your experience. We give you the floor.
Thank you very much. Okay, let's hope the technology works. Okay. Can I just check that you can hear me okay?
Yes.
Wonderful. Okay, so I thought very carefully about how I might present the work that we're doing here in Greater Manchester that would help the conference and your delegates find out more about the approach that we're taking up in the northwest of the UK. And I thought maybe the idea of innovation and social inclusion was an important aspect of this debate. So I'm going to use that really as the theme throughout my presentation. The image you see in front of you represents two things really. First of all, it's the 10 local authorities. So these are the age profiles of the 10 local authorities in Greater Manchester, from birth on the left-hand side to death on the right-hand side. Then you can see the third one down, which is City of Manchester, has this huge youth bulge. The other thing it represents, for those of you who have an interest in these things, is it's a homage to an album by a very famous Mancunian rock group from the 1970s called Joy Division, who then became New Order. So it appeals to those baby boomers amongst us who've grown up and lived in the city over the last generation. So this really is just a short introduction. We know, like many other areas in Western Europe, in North America, in the emerging economies, and that aging populations are having a profound impact now and will have in the future. And in Greater Manchester, again, like other areas, we want to explore the opportunities of aging as well as the challenges. And our argument essentially is that this means that we have to work together differently, and we have to think about aging as a strategic priority for our city region. As you can see here, our region is close to 3 million people living in 10 municipalities. And last year we had our first elected mayor, Andy Burnham, who was formerly the Secretary for Health in the UK government under Tony Blair. So we know that the ground under our feet is shifting very quickly, and it's the role of public agencies with others to act quickly and act in the long term to make better lives for our older residents. I mean, this is data that, well, I'm sure is familiar to you all, but often I think for policymakers and city leaders and private citizens and private businesses, the actual scale and scope of population change is not well realised and not well understood. And one of our roles, I think, in this space is to consistently and clearly set out what the impacts of population change will be in a generation. And I think what is typical of the work in the ageing space in the UK is it is often of short-term, defined by short-term pressures on health and social care systems and on housing agencies. and really a clear message that has to go out from those of us in the ageing world is that whilst we need answers for the short-term pressures of ageing populations, that we need to set out a compelling vision for long term. And I recommend this small book that's on the right hand of your screen called an alternative age-friendly handbook, which is a beautiful publication which you can find, I'm sure, on the internet, certainly at the University of Manchester. And I think it's the most one of the most beautifully written and argued publications. So the other theme I wanted to bring in at the start really was this idea of unequal ageing. And this map in front of you is the 10 Greater Manchester municipalities. And what it does, the darker the colours, the higher levels of unemployment amongst people in their 50s and early 60s. And what we're trying to represent here, first of all, is that there is a job to be done for those of us in the ageing world in this midlife group, not least because of the impacts on the communities and individuals that live in these areas, but also because of the medium and long-term impact of poverty and inequality in midlife. And I'm sure it's the same in many of our post-industrial cities across Europe, that we have this poor quarter or fifth of the population which is detaching itself from the rest of the ageing population. So for us, innovation in its broadest sense and the technologies and services and goods that we develop have to include considerations of unequal ageing. Most of you will be familiar, I'm sure, with this slide or with this concept of the age-friendly city. And you may know that Manchester was the first UK city to join the global network, and subsequently Greater Manchester was the first city region in the UK to become a member of the global network. And I think it gives an excellent platform for collaboration. I'll speak more about this towards the end of my presentation. But I think we have to continue to return to these different dimensions, these different domains of ageing, and not to be corralled into just thinking about certain aspects. It's the intersection of these different domains of ageing which creates, I think, creativity and innovation. So a little bit about the organisation that I head up. We were established 2 years ago to coordinate a strategic response to the opportunities and challenges of ageing. We have governance with political leadership and chief executive leadership. We have a range of partnership groups and boards. We work closely with the new Greater Manchester Older People's Network, and we have a 5-year partnership with the UK Centre for Ageing Better, which is a £50 million think tank funded by the big lottery here. One of the important things in our work is that we've been able to establish ageing as one of 10 Greater Manchester strategic priorities. And this is fairly unusual in the UK, that ageing, rather than just health and social care, is a city or a regional priority. And these are the 3 sub-objectives in our strategy. The first one is to be an age-friendly city region. The second one is to be a global centre of excellence. And then the third one is to increase economic participation amongst the over 50s, reflecting the concerns that we have in the previous slide. And this is very important because what this does, it gives us the opportunity to act, to convene, to bring city leaders with others together to set out programmes and priorities over the short, medium and long term. Our programme is organised around these themes and ways of working, and I've highlighted the innovation and research way of working on the right hand side really as a pivot and as a theme that runs right through all these different themes. And I'm going to go on in a minute to talk about some specific examples of how this is working. But on this slide I just wanted to highlight 2 or 3 things. So what we tried to do here over the last 2 years or 18 months is trying to assemble system leaders or system leadership across these themes. So, for example, in the economy and work area, we bring together a range of partners. So, colleagues who provide the kind of strategic leadership on this agenda, with colleagues in our universities. We also have representatives of the National Health Service and of jobs employment agencies as well. And the idea here is that we're trying to create a platform of innovation to try and shift and address high levels of unemployment amongst our midlife populations. So that's generally the approach that we take throughout all of these initiatives, bringing together the academy, the universities, with national and international think tanks, policymakers, citizens, and where we can, private sector agencies, which, as you know, is known as the quadruple helix in the kind of European context. I should also mention a couple of other things here, because I think underpinning all of our work is this challenge to shift the narrative of ageing away from one of deficit and to one which is of opportunities. And it seems to me that critical to that is giving the voice to different groups of older people, and also to give them agency and leadership in the work that we do, and I'll explain that more later on. I'll also just want to mention this issue of leadership in terms of innovation, because I think we see leadership in this area at 4 levels. So the first level is the city political leadership. At the kind of grassroots level, we need to combine that with an emerging social movement of neighbourhood groups that we work with here. And then there's got, I guess, the intermediate levels of municipality and the organisations that cluster at that level. So this is really, I suppose, a matrix of how we work. I want now to just give you some examples in Greater Manchester of how we're trying to develop and implement this idea of innovation. And I've said from large to small, really, again, representing this this issue of doing work at different levels. So we're currently in early stages of a £1 million programme to try and raise physical activity rates for older people. Here in the UK, we have very low physical activity rates amongst many different groups of older people and different minority ethnic groups and so on. So this is a priority for us. And the approach that we're taking is to try and build out from neighbourhoods the types of physical activity and types of social engagement and social action that people want to do, rather than us as public agencies set out what we expect people to do. And I think this is an exciting area of work. In terms of transport, we recently published a report in conjunction with Swansea University on a set of propositions around transport and ageing populations. And this, as ever, is a priority for older people. Our transport systems tend to be designed around the need to get people in to work and out of work at peak times. But what we know is that if we get this area right, then many other things follow. I mentioned the work and skills agenda, and we're working with central government on that. We've also picked up this idea from Age-Friendly New York City, which again I think is a nice piece of innovation around working with small businesses for them to be age-friendly businesses. And we've done this using a program called Take a Seat, where the local business signs up to a business charter which includes providing seating, maybe use of toilets, providing a drink maybe for older residents so that they can plan their visits to the shops, that they can be safe in the fact that they're going to get a good quality of service. Another central element of our work is the development of 25 neighbourhood schemes across Greater Manchester, which is a £10 million programme called Ambition for Ageing. And this is designed as a kind of test and learn programme. What are the small scale innovations in a community led by panels of older people which can change the quality of life of older people? And that's a 6-year programme. We're in year 4 at the moment, and it's one that we hope will push real grassroots innovation. At our local authority or municipality level, each of our 10 authorities is developing their own age-friendly plan or ageing plan, and they will be ready by April of next year. The other area of work which is demanding a lot of attention from us is around housing and planning. Now, we know most of the housing that older people will live in over the next generation has already been built. So a significant amount of our focus is on making sure that that housing is fit for purpose, that it's age friendly, that it includes the innovations and improvements that we can make, but also alongside that, that new forms of housing are designed sympathetically and are integrated and promote social inclusion and don't promote, I suppose, social exclusion. We have a fantastic project in South Manchester called in the Old Moat area, and I would recommend you look at that. It's a partnership with a housing association, 2 universities, and again, a panel of older people, bringing together kind of spatial analysis of ageing along with a kind of sociological analysis. We're also signed up to launching rather a Centre for Age-Friendly Culture in 2020. And this is a result of 10 years of collaboration with up to 40 arts and heritage organisations, primarily in the centre of Manchester, but now inclusive of other local organisations. And here the challenge really, and I know you have a beautiful museum in San Sebastian, which I visited 2 or 3 years ago. And the idea really is that for these public facilities is to see how they can support good quality of life of our older residents, particularly those in the most disadvantaged communities. And I guess if I was pushed, I would say this is for me personally, the most exciting and interesting area of work for us, because it changes how we think about aging. It enables older people to explore opportunities, to explore themselves, to explore their purpose in life and the meaning of life, I guess, on one level, in a way that most of our other work around ageing never really touches on. And last but not least, we have a platform in Greater Manchester called Health Innovation Manchester, which brings together private agencies with universities and the National Health Service in Greater Manchester to develop a pipeline of goods and services and applications for health and social care services. I'm just going to finish with this slide on some of the next steps that we are taking in Greater Manchester. So the first thing to mention, in the context of the very difficult situation we have at the moment in the UK in terms of Brexit, is that we are committed to continuing our work with our European colleagues on a number of different platforms. So the first is the EIP. Secondly, we work with Eurocities, which is led by Oslo and Amsterdam in their urban ageing platform. We also collaborate with WHO Copenhagen on their healthy ageing program. And we have just signed, this time last week, I was in Luxembourg to sign a contract with the EU ESPON programme to collaborate with 7 European cities, including Zaragoza and Barcelona, on a year's research project. The last thing I just wanted to mention is how we're bringing all this together over the next few years. So Greater Manchester is developing a local industrial strategy. And as part of that, there is a national grand challenge on ageing. And we've identified 4 important areas of work that we want to improve on. First of all, older workers, as I've mentioned. Secondly, a programme of neighbourhood scale collaborative initiatives across Greater Manchester, from the urban core out to the semi-rural areas that support ageing in place. Thirdly, on social care transformation, including remote technology and the use of technology in supporting quality of life. And last but not least, we have an ambition to develop a new innovation platform for Greater Manchester on ageing, which mobilises this idea of the quadruple helix, in which we create, on the one hand, a test bed for social innovations and other innovations, but also we create a movement for change on ageing, which will be able to transform how we think about older people ageing later in life over the next 5 to 10 years. So thank you for listening. If you want to contact me, I have an email address. We have 2 Twitter accounts, and hopefully the next time we meet and speak with each other, you'll be able to see, we'll be able to see each other face to face. Thank you very much.